Hi, my name is Dr. Lydia Gray. I'm the staff veterinarian here at SmartPak, and today we're going to talk about colic, what it is, how to recognize it, what to do and not to do, and what your vet's going to do when he or she arrives on the scene. First, let's talk about what colic is. It simply means abdominal pain. It doesn't refer to a specific location or particular cause. And it can range from mild or transient, maybe you don't even know it happened, to a severe, life-threatening, intractable, painful episode with your horse that may or may not be correctable with surgery. So it can be life-threatening and it can be very serious, which is why recognizing it is so important. According to the American Association of Equine Practitioners, which we shorten to AAEP, about 10% of the U.S. equine population experiences an episode of colic each year. So that's around 900,000 horses, quite a few. And again, that's why it's so important to be able to recognize what colic is and then take action immediately. The AAEP has a very extensive list of colic signs in horses, and some of these include the common pawing and rolling, having a high heart rate, having a high respiratory rate, and lip curling, something that my own horse does. This grimace, often called the Fleming response, is how I recognize abdominal pain in him. If you notice these signs in your horse, the things to do are take all food and water away, put your horse somewhere safe for you and him, collect whatever vital signs you can, and then immediately call your vet, giving him or her the following information: specific signs of colic and their severity, the pulse or heart rate in beats per minute, the respiratory rate in breaths per minute, the rectal temperature, color of the gums, this could be white, pale pink, dark pink, red or bluish purple, the moistness of the gums, moist, tacky or dry, the refill time for the gum color, called capillary refill time, digestive sounds, if any, bowel movements, including the color, the consistency, and frequency, your horse's medical history, including deworming and any past episodes of colic. Also add any recent changes in management, feeding, or exercise, the breeding history and pregnancy status, and the insurance status of the horse. Depending on how much pain your horse is experiencing, your veterinarian may go right to work treating him and relieving that pain, or stop and ask you some questions, so be prepared for that. Also be prepared for how invasive and unpleasant, but necessary and helpful, some of the tests that your veterinarian may do on your horse are. For example, the rectal palpation, passing a stomach tube, drawing some peritoneal fluid out of the abdomen called a belly tap, and also drawing blood. But these things all help the veterinarian know, will the treatment that we're using today help the horse resolve the colic medically? That's fluid therapy and the painkillers and the laxatives, or does this horse need to be referred to surgery? If so, then if your horse is enrolled in Colic Care, our $7,500 colic surgery reimbursement program, that decision may be easier. I hope this review of colic has been helpful to you. Above all, stay calm and remain safe.